All right. Hi, my name is Victoria Leach, and I'm going to be doing my project on McBurney's sign. This is a test that is performed on the abdomen, and the purpose of this is to help determine if someone has appendicitis. So first, when you suspect that your patient has appendicitis, the first thing you want to do is ask them to lay in a supine position, and then you would ask them to cough or perform Valsalva's maneuver and point to where the pain is located. Then you would want to palpate their abdomen to feel for tenderness. This doesn't 100% mean that they do have appendicitis, but it does mean that the diagnosis is suspected. At this point, the pain will be felt if someone is putting pressure on that point, or they also will just be having pain in general. This is suggestive also that the appendix can soon be rupturing. The test would be performed in the lower right quadrant of the abdomen, and this can be used in really any situation. You can do it at home, if someone comes in the emergency room, in a doctor's office, really anytime appendicitis is suspected. Now I'm going to demonstrate how to find McBurney's sign. This is Zach. He's going to be our patient, so I'm going to ask him to lay down in a supine position for us. And I'm going to ask him to pull his shirt up a little bit. So at this point, I'm going to ask you to cough and point to where your pain is located. Right there. Are you having severe pain right there?
Yep.
Okay. So next you want to palpate the abdomen just right here. Does this hurt when I do this?
Yeah.
Yes. Okay. So how to find McBurney's sign? When you put your hand down, you want to feel for the anterior superior iliac spine, and then you're going to locate the umbilicus. Just draw an imaginary line from the umbilicus down to the anterior superior iliac spine and go up about 2/3, and right there is where McBurney's point is located. An easy way to do this too is just when you put your hand down, you can feel that bone sticking out, and then you know you just have to go up about 2/3, and then you're right on the correct spot, and the patient will be having pain there. All right, you can put your shirt back down. We can sit back up. So a normal finding of this would be that there's no pain located at all in this area. An abnormal finding would be that there's severe pain in this location, which does suggest appendicitis. If someone does have severe pain, the pain goes away. This can also mean that the appendix has ruptured and they would need to go to the OR for surgery right away. So now I'm going to talk about the pathophysiology of appendicitis. So this states that appendicitis results from an obstruction in the appendicular lumen. This can be related to lymph node hyperplasia, fecal matter, a foreign body, or even worms. The obstruction eventually leads to distension, bacterial overgrowth, ischemia, and inflammation. Because of this, the obstruction is what's causing that severe pain in that area. McBurney's sign was originally created by Surgeon Charles McBurney. He was the one who found that applying direct pressure to this area causes severe pain. Also, when they do an appendectomy, the surgical incision they make is also called McBurney's incision. This spot is located right about where the appendix is, and that's the spot that shows the most pain in appendicitis. So if someone does come in with appendicitis, further assessment that you would like to discuss with them is ask them when their pain has started. Also ask them if they had any cramps, diarrhea, constipation, gas, burning with voiding or inability to void. You also want to check a temperature because they can be having low-grade fevers as well. Sometimes with appendicitis, the pain will start in their epigastric region, and they can have some nausea and vomiting, and then the pain would move to the right lower quadrant, or where McBurney's sign is. Other tests you want to look for are Roven's sign. This is when you palpate the left lower quadrant of the abdomen, and the patient can feel the pain in the right lower quadrant. Also, Aaron's sign is when they have referred pain in the epigastric region when pressure is applied at McBurney's point. Also, rebound tenderness pain can occur when you press down on their abdomen, right when you take your hand away, they feel the pain when your hand is not touching them anymore. This can be suggestive of peritonitis, which does occur with appendicitis. Some imaging the doctors may like to look at would be an X-ray, a CT, or an MRI to confirm that the patient does have appendicitis. They also may do a blood or urine test and a rectal exam. It's important to listen to their bowel sounds, because sometimes with appendicitis, bowel sounds would be more decreased on the right side when you compare them to the left. And I think that's it. Thank you for watching.